Good morning and welcome. Thank you so much for joining the listening session today. My name is Star Jones and I am the Cancer and Chronic Disease Prevention Unit Manager here at the Wyoming Department of Health. And today I'll be discussing the purpose of the Wyoming Cancer Program. So the Wyoming Cancer Program has a few different components. The one that you're most likely familiar with is the breast and cervical and colorectal cancer screening programs. The breast and cervical cancer screening portion is funded by the Centers for Disease Control and Prevention and offers services such as mammograms, Pap tests, and clinical breast exams. The colorectal cancer screening portion of the program is funded by state general dollars and tobacco settlement funds. That program covers at-home stool testing options such as FIT kits and Cologuards and colonoscopies for Wyoming residents. The comprehensive cancer control component of the program facilitates more of the outreach side of the program with activities such as the Wyoming Cancer Resource Services and the Wyoming Cancer Coalition. We also support the work outlined in the 5-year cancer plan. Lastly, we also house the Indoor Radon Grant, which covers free radon tests for Wyoming residents. So our mission is to reduce the burden of cancer through evidence-based screening and prevention strategies, including education, support, collaboration, and resource sharing in Wyoming. So what does all that mean? That's what we're going to be touching on today. So everyone attending this call has heard the word cancer. Chances are you've either personally had cancer or you know someone who has. Did you know that men have a 1 in 2 chance of being diagnosed with cancer during their lifetime? And for women, the chances are 1 in 3. So let's look at some quick facts about the cancers that we specifically focus on here at the Wyoming Cancer Program. 1 out of every 8 women in the United States will develop breast cancer in their lifetime, and 1 out of every 3 of those will become metastatic. So mammography correctly identifies about 87% of breast cancers. Cervical cancer is the 4th most common cancer among women, and 75% of cervical cancers could be prevented by cervical screening. Colorectal cancer is the 2nd leading cause of cancer-related death in the United States, with 1 in 20 people being diagnosed. So luckily, with modern medicine advances, there are ways to screen for some of the most common types of cancers, such as breast, cervical, and colorectal. So I'm sure you've all heard the saying that early detection saves lives. Well, it truly does. In the last 30 years, screening has helped lower the U.S. death rate by more than 50%. So if that's not a good enough reason to screen for cancer, let's take a look at the numbers. In 2020, the cost of cancer in the United States was $158 billion. One study estimates the national cost savings in the United States from early diagnosis was $26 billion per year. So the earlier cancer is detected, it's cheaper and easier to treat. Early detection and treatment of breast, cervical, and colorectal cancer through screening reduces mortality rates and greatly improves cancer patient survival. The goal of the Wyoming Cancer Program is to decrease cancer incidence, morbidity, and mortality by providing breast, cervical, and colorectal cancer screenings to those who are uninsured and underinsured. Now, why is this important? Did you know that cancer has a greater impact on some people versus others? Those living in any of these groups identified on the screen, such as racial and minority groups, lower incomes, anyone who's uninsured or underinsured, LGBTQ population, those with disabilities, and those who live in rural areas such as Wyoming, they're all disproportionately impacted by cancer. And all of these things can impact a person's access to health care. All of these people live in our communities, but they may not be getting the cancer screenings that they need. So you might be asking yourself, how am I supposed to increase cancer screening rates when I already screen everyone who's coming into my clinic? Well, approximately 40% of United States adults say that they don't go to the doctor regularly. So this makes it extremely hard for providers to conduct their wellness exams and recommend any preventative cancer screenings. You can't screen someone if they're not coming in. So how are we doing as a state when it comes to screenings? So about 62% of Wyoming women are up to date with their mammogram, where nationally we're at about 76%, 66% for cervical, and nationally again 87%, 62% for colorectal cancer, and nationally 74%. So we have a long way to go if we're going to meet the national goal of 80% in every community. So how do we get there? One of our goals at the Wyoming Cancer Program is to meet people where they're at, where they live, where they work, where they access care, and what community resources they use. As the saying goes, it truly takes a village. We want to work together with those of you who are already in the communities. You know what the unique needs are in your community. You know what your community has and what it doesn't have. You know what you need. You know where your community goes to, what they participate in. Essentially, our goal is to find those people who aren't going to the doctor and bring the screening opportunity to them. Educate them about cancer screening and its importance, support them and you in getting those cancer screening tests completed. The past few years, we have been working on identifying ways to increase access to screenings, and some of the things that we have done is supporting community screening events where breast cancer screenings, such as mammograms or clinical breast exams, are held in the evening or on the weekends, where barriers that would prevent people from attending a screening can be addressed and overcome. This is done in partnership with the Wyoming Breast Cancer Initiative. But we've also done a Fit Kit project where alternative colorectal cancer screening options were offered. We've done media campaigns, reminder cards, and other various community events. Our vision is to shape a healthier Wyoming in order to eliminate the burden of cancer. All of these things are only possible when we're able to join forces with people actively working to do the work in their communities. Over the next year, the Wyoming Cancer Program is going to be focused a lot more on outreach, finding people that need cancer screenings, navigating them through the process, making it easier to access that care. Our hope is to be a better partner alongside of you to create a healthier Wyoming together, one cancer screening at a time. With that being said, this presentation concludes our provider listening sessions for a while. We have a lot of really great program changes underway, and we need some time to focus on those. We look forward to your continued participation in these programs. We welcome your ideas and suggestions. And we're always trying to improve the program processes to make it easier from start to finish. If you have any thoughts, suggestions, or feedback, please feel free to reach out to us via email or by phone. And visit our website for any up-to-date information about the program. As we're updating and changing things, we'll be doing some media releases, and we'll definitely make sure to update our website. So that's a great resource for you to get the latest information. Thank you so much again for joining and for prioritizing the health of Wyoming people and making a better community for everyone. We appreciate you so much.